Juvenile delinquency can be defined as criminal behavior that is committed by an individual who has yet to reach adulthood. Child delinquents are individuals who commit criminal behaviors and have yet to reach the age of 13. Approximately 9% of all juvenile delinquency crimes are perpetrated by those who have yet to reach the age of 13. Juvenile offenders can be tried in adult criminal court, if their offenses reach a certain threshold, and this varies by state. Most of the criminal offenses committed by juveniles are for status offenses, meaning those are offenses that are only for individuals who are juveniles. For example, smoking, as that's illegal if you're not 18 years old. Same thing with drinking at 21 years of age. But then there's also things like being out past curfew, if there's local laws that say you need to be in by a certain time. Things like running away, and incorrigibility, which is basically a total failure to respond to the requests of authority figures. In defining juvenile delinquency using psychological terms, we can find a few diagnostic criteria that is fairly highly correlated with criminal behavior. First being conduct disorder. Conduct disorder is a fairly serious disorder where there's a strong pattern of fairly significant antisocial behavior, such as fire starting, pyromania, theft, assault, things like that. To be considered antisocial personality disorder in adulthood, an individual has to have evidence of a conduct disorder prior to the age of 15. So some of the other disorders that are correlated with juvenile delinquency includes oppositional defiant disorder. And this is a disorder where the juvenile will have a hard time trusting authority figures, oftentimes acts out towards authority figures, peers, doesn't really like to be told what to do, and they are more incorrigible than their peers. Attention deficit hyperactivity disorder, especially the type where impulsivity is more of an issue, as well as the combined type where there's impulsivity and inattention. ADHD of the inattentive type, there isn't as much correlation to criminal behavior, although it is somewhat correlated. Then there's behavior disorder not otherwise specified, or NOS, which is a category where it doesn't meet any specific diagnostic criteria, but it does impact kids behaviorally, and they sometimes tend to have acting out behaviors that can break the juvenile code. And then there's a non-diagnosable label called antisocial behavior, which for you DSM junkies is a V code, meaning you may be able to receive compensation for treatment for that, but it is not an actual diagnosis. But it's basically people who are in treatment for criminal behavior, juvenile delinquency, that does not meet the criteria for, again, a specific disorder. So here's a few select statistics related to juvenile delinquency. There's approximately 30 million juvenile delinquents under the jurisdiction of courts in the United States. There's also approximately 2 million arrests each year for crimes committed by juveniles. Approximately 15% of all arrests are arrests involving juvenile delinquents. And they encompass the following crimes. 26% of property crimes involve juveniles, 16% of violent crimes, 47% of arsons, 38% of vandalism, 18% of sex offenses, and 15% of forcible rape offenses. 10% of murders, 27% of robberies, 11% of drug offenses, and 22% of liquor law violations involve juvenile delinquents. Like the vast majority of criminal behavior, there's gender differences that can be found. Boys do far outnumber girls in the number of juvenile arrests, yet females do slightly outnumber the boys in status offenses. Testosterone may play a significant role in juvenile violence and offending types of behavior, and obviously boys will have more testosterone. Female delinquency is on the rise. Female violence, when it is present, it's usually correlated to the following: peer violence, violence in schools, violence with disadvantaged neighborhoods, girls in gangs, and family violence. Criminal behavior, as we've seen from the first several chapters, develop in a variety of ways. Children and adolescents who are juvenile delinquent tend to have developmental pathways, again, that are very different than pro-social youth. Children who are more antisocial tend to have significant problems with impulsiveness. They have poor social skills and less empathy for other people. A rule of thumb is the more serious and persistent delinquency is, typically the earlier it occurs, and it will tend to worsen with age. The life course persistent offenders, which are approximately 10 to 1 male to female, are juveniles who habitually offend, who will much more likely have criminal careers. They have criminal behaviors that cross situations, where adolescent limited offenders, which again is way more common, much more common, and their antisocial behaviors tends to start in their teen and adolescent years and tends to fade and most often go away once a juvenile reaches adulthood. Then there is the coercion development model, which states that individuals who have significant antisocial behaviors tend to have very poor parental monitoring, disruptive families, inconsistent discipline. Oftentimes their parents are separated and they don't get along very well and they don't have consistent parenting. This especially is influential in early offender behavior. Prevention and treatment of juvenile delinquency is one of the highest priorities in law enforcement, because if you can prevent something or stop it at an early age, chances are we can go on to reduce criminal behavior, or at least in theory during adulthood. There are many juvenile types of programs, past and present, but only a few have been proven to, through research, be successful and have good outcomes. Serious offenders tend to be more resistant to change. Again, so if we can step in early, it's more than likely we can make a greater impact. Too often, interventions don't happen early enough, and treatment starts too late. We are seeing positive changes that are occurring at a higher and higher rate, and there's more and more research out there to show what are some of the most important variables in successful treatment of juvenile offenders. We're even finding that even the more serious offenders are treatable under the right conditions. Characteristics of successful juvenile delinquency programs include the following. They begin early. They follow developmental principles. They focus on multiple settings and systems. They acknowledge and respect cultural differences and backgrounds, and they focus on the family first. There are three distinct classes of prevention and treatment programs within juvenile delinquency. First is the primary prevention, which tries to prevent juvenile delinquency from occurring in the first place. This is programs such as DARE. Secondary prevention are programs that are aimed at high-risk groups and individuals who might be showing early warning signs of criminal behavior. And then there's the tertiary prevention, which is basically treatment of juvenile delinquency. There are many different treatment programs for juvenile delinquency. One of the most commonly used is residential treatment. There's also wilderness and adventure therapy programs such as Thistledew in Togo, Minnesota, which I get the pleasure of working at a day a week. There's boot camps, and then there's community treatment or outpatient types of treatments, and the most successful community outpatient types of programs tend to focus on cognitive and behavioral skills. Thinking for a change, for example, is a curriculum oftentimes used. Social skills and anger management training, and multi-systemic therapy, especially when bringing the family into the therapy with them.